Okay, so the first thing you have is the liver. The liver is located in the upper right hand quadrant, and it's divided by the falciform ligament. So you have the right lobe of the liver and the left lobe of the liver. From the right lobe of the liver comes the right hepatic duct, and from the left lobe of the liver is the left hepatic duct. So right hepatic duct, left hepatic duct. Okay, once the right and left hepatic duct join together, then it is called the common hepatic duct. Okay, then meanwhile you have the gallbladder, and from it comes the cystic duct. And once the common hepatic duct joins up with the cystic duct, now you have the common bile duct. Okay, so then also over here you've got the esophagus and the stomach. So stomach. Okay, and then from the stomach you've got the C loop of the duodenum. Within the C loop of the duodenum is the pancreas. So here's pancreas. Here is duodenum. Okay, so the common bile duct then travels back behind the duodenum. From the pancreas you have the pancreatic duct. Okay, so the common bile duct and the pancreatic duct, then they join together. And so that is called the ampulla of Vater. Or the hepatopancreatic ampulla. And then that duct opens into the duodenum. And that duct is controlled by a circular muscle called the sphincter of Oddi. Okay, so what this demonstrates is how the alimentary tract, so which is the big long tube, so the esophagus, stomach, small intestine, large intestine, that is all the alimentary tract, and then you've got the the accessory organs, which is the liver, gallbladder, and pancreas. So it shows how these two systems, how they interact. So you've got the alimentary tract, and then you have the accessory organs. And so this demonstrates how the two systems come together. And so both of them are considered the digestive system. Okay, so what you need to know then is that the liver makes bile. The liver makes bile, and then once it makes the bile, it sends that bile into biliary ducts. And so all of the little biliary ducts from the right lobe end up in the right hepatic duct, and all of the little biliary ducts from the left lobe end up in the left hepatic duct. Then those two, the right and left hepatic duct, join to form the common bile duct, the common hepatic duct. That bile is stored in the gallbladder until the body needs it. When the body does need it, the gallbladder contracts, and then that bile is excreted from the gallbladder and it goes down into the common bile duct. It meets up with the pancreatic duct, and then the bile and the pancreatic enzymes are released into the duodenum via this ampulla of Vater or hepatopancreatic ampulla. And again, that opening or that ampulla is controlled by the sphincter of Oddi. So some things that can happen along these ducts are there could be a stone anywhere in this system. So if there is a stone, if there is a biliary stone, then that could cause an obstruction. And so that all of that bile then would back up into the liver and cause problems. Also, malignancy can constrict all of these biliary ducts, one or any of the biliary ducts, and again, that would cause an obstruction, and then all of the bile, which needs to be released from the liver, would again be trapped um, in the liver. One more thing I'll mention real quick, if we're talking about a percutaneous procedure, then we're talking about an actual needle puncture from the skin into the liver. So that would be a percutaneous procedure versus an ERCP, which is an endoscopic retrograde cholangiopancreatogram. So that would involve an endoscope going down the mouth, into the mouth, down the throat, into the stomach. So this scope would then get to here, and then a catheter would cannulate this ampulla, and then different interventions can be done through this. You can inject contrast and just simply visualize all of these ducts, or a stent can be placed that way. And the reason I mention this is because the ERCP procedures have largely taken over the percutaneous procedures. But again, there's different reasons why one procedure is done over the other. A lot of times the ERCP isn't successful, and so then you have to do a percutaneous procedure. But the main objective of this lesson is to demonstrate the accessory digestive organs and the alimentary tract of the digestive system, and how the two systems come together and to make up the digestive system.